we have just produced a new policy report called the Plant Powered Planet, which looks at the intersection of climate change, food systems, and health. So we've produced this in partnership with plant-based health professionals UK, the Royal College of Veterinary Standards, the UK Kidney Associations, who are all members of the UK Health Alliance. So when we started looking at the food system and just trying to look at what the environmental problems are of the current food system, like we looked at how it impacts the climate, which is 1/3 of the global greenhouse gas emissions, but it's also 11% of the UK's greenhouse gas emissions. And out of this, the majority, which is 70%, is from red meat and dairy. We looked at the different aspects, so like intensive livestock farming, which is a huge problem because of the growing demand for meat. And agriculture, especially animal agriculture, is like the primary driver of biodiversity loss because of habitat changes, deforestation, and water scarcity. All of these aspects which are driving biodiversity loss. Then it's also an emitter of air pollutants. Then there's disproportionate land use. For example, in the UK, 85% of the land is used to raise animals, including the feed for them, which is mainly monocultures. And apart from that, like the problem with cattle is the huge amount of methane, which is even a more potent greenhouse gas than carbon dioxide. Then there's ammonia and nitrate pollution. So these are sort of the summary of the environmental harms of our current food systems. Then we looked at what is the health impact of the food system. So every 1 in 4 adult and 1 in 5 children in the UK are obese, which makes them prone to obesity-related non-communicable diseases such as diabetes, cardiovascular diseases, and cancer. The current food system is also widening health inequalities because poorer households are twice as likely to be obese and eat 42% less fruits and vegetables than the recommended 5 a day. And this is because healthy, nutritious food is twice as expensive as unhealthy food for every 1,000 calories. Further, in 2020, 70,000 deaths were linked to the inadequate consumption of plant-based foods, and 42,000 deaths were linked to overconsumption of red meat and processed meat and dairy in the UK. And I just wanted to flag here that processed red meat is a group 1 carcinogen as classified by the WHO, and red meat is a group 2 carcinogen. So despite knowing this, we continue to serve it everywhere. Now, before I move forward, I just wanted to say what is a plant-based diet, because I'll be talking a lot about plant-based diet. So we're just referring to the Eat Lancet Planetary Health Diet, which you can see that it basically emphasizes a predominantly plant-based diet where whole grains, fruits, vegetables, nuts, and legumes comprise more than 85% of your plate. And if there's meat and dairy, it should be a very small portion, as you can see in the pie chart. Going to the recommendations. So we have 6 recommendations for the UK government and the developed nations. The first one is to drive sustainable agricultural transformation, which is to support farmers to grow more plant-based products by giving them appropriate subsidies, grants, and low-interest loans. And the other is to regulate and ban intensive livestock farming operations. The next recommendation is to subsidize and incentivize plant-based choices and cut red meat and dairy by 30% by 2030. As you can see, 48 kilograms of red meat was given per person per year, was supplied in the UK in 2021, which is twice the UK government recommended limits. So that's why there's a need to subsidize and incentivize plant-based products in supermarkets, restaurants, cafes, and reduce the red meat and dairy demand by 2030. We've looked at one option of like taxing red meat and using the funds to make healthier plant-based options more affordable. To develop a new national food strategy with plant-based food at its core. So this would promote plant-based eating and also to fortify plant-based alternatives to ensure that the nutritional recommendations are met, and of course reduce red meat and dairy demand. And this is what I was talking about before, that for every 1000 calories, healthy foods cost twice as much as unhealthy options, which makes it difficult for poorer households to afford it. The next recommendation is to cut food waste by half. This would require mandatory reporting of food waste as well as ensuring all local councils collect household waste for recycling every week. Then the next is to fuel innovation by investing in a plant-powered future, which is to invest in research and innovation and dedicate a significant amount of funding to plant-based alternatives. The next one is to revolutionize school meals by promoting healthy and sustainability by offering plant-based choices to the next generation, because this would help them develop healthy habits right from the start. This would require revising the National School Meal Guidelines, which sort of mandates schools to provide 3 portions of animal-based protein every week and dairy every 5 days, which is basically every school day. And this would require launching cross-sectoral educational campaigns and workshops to promote plant-based meals and again emphasize reducing red meat and dairy consumption. So these were the 6 recommendations for the UK government and devolved nations, and now we are moving on to the 5 recommendations which would help build an NHS fit for the future. The first one is to make plant-based choices the new norm and phase out processed red meat in hospitals by 2030. LJ would speak a lot more about this, so I'll just quickly say that this is important because it has health benefits, because processed red meat is a group 1 carcinogen, as I mentioned before. It has environmental benefit and it has cost savings, as we've seen from the New York studies. So, for example, if everyone eats meat-free lunch 5 days a week, just 5 days a week, that would save the NHS £2.2 billion per year and could fund the annual salaries of 59,805 resident doctors. So no more strikes. Then the next is to promote healthy and sustainable diets. So this is for health organizations in addition to the NHS, health organizations such as the Royal Colleges and everyone should commit to fully prioritize plant-based catering for everyone and promote the health benefits of such diets. The next is again to cut NHS food waste by 50% by 2030, and this would require the reporting of annual food waste by NHS trusts and to develop strategies on how to reduce this waste at hospital level. The fourth one is to empower health professionals by boosting plant-based nutritional knowledge, because there's a huge gap between the knowledge of plant-based nutrition amongst health professionals, and then building the capacity of health professionals and then encouraging health professionals to create awareness amongst patients about these health benefits is important. For example, as we know that adults require 30 grams of fiber every day, but only 20 grams of fiber is being consumed in the UK. But eating a plant-based diet could help achieve this. So sort of communicating such key messages with patients is important. Then the last one is to end financial support to industrial livestock companies. This would involve switching to green banks and divesting from large industrial livestock companies. Thank you, and you can scan the QR code and have a look at the report.